Stroke is a leading cause of death in men. Stroke is also a leading cause of long-term disability, and men under age 44 are hospitalized for certain types of stroke at a higher rate than women in the same age group. These facts are alarming, but there is good news. About 4 in 5 strokes are preventable. That's why it's important to know your risk for stroke and take action to protect your health. A stroke, sometimes called a brain attack, happens when blood flow to an area of the brain is blocked or when a blood vessel in the brain bursts. When brain cells are starved of oxygen, they die. Stroke is a medical emergency. It's important to act fast and get treatment as soon as possible. Some treatments for stroke work only if given within the first 3 hours after symptoms start. A delay in treatment increases the risk of permanent brain damage or death. Here are factors that put men at risk for stroke. Number 1. High blood pressure, also called hypertension, is a major risk factor for stroke. Half of men, 50.4%, have high blood pressure greater than or equal to 130/80 mmHg, or are taking medicine for their blood pressure. 4 out of 5 men with high blood pressure do not have their blood pressure controlled. Number 2. Smoking. Smoking damages blood vessels, which can cause a stroke. About 1 in 7 men smoke. Men are also more likely to be smokers than women are. Number 3. Overweight and obesity. Having overweight or obesity increases stroke risk. About 3 in 4 men in the United States have overweight or obesity. Number 4. Diabetes. Diabetes increases stroke risk because it can harm blood vessels in the brain. About 1 in 7 men have diabetes. Number 5. Too much alcohol. Drinking too much alcohol can raise blood pressure levels and increase the risk for stroke. It also increases levels of triglycerides, a form of fat in your blood that can harden your arteries. Men are more likely than women to drink too much alcohol. Number 6. Not enough physical activity. Not getting enough physical activity can lead to other health conditions that can raise the risk for stroke. In 2017, about half of men met the guidelines for aerobics and muscle strengthening. Here is why African American men are at higher risk for stroke. More than 1 in 2 African American men have a blood pressure greater than or equal to 130/80 mmHg, or are taking medicine to control their blood pressure. About 1 in 9 African American men have been diagnosed with diabetes, and many more have the disease but do not know it. Sickle cell disease, a common genetic disorder in African Americans, can lead to a stroke. About 1 in 365 African American babies are born with sickle cell disease. About 1 in 5 African American men smoke. About 7 in 10 African American men have overweight or obesity. U.S. adults, including African Americans, consume more than the recommended amounts of salt or sodium, which raises blood pressure and increases the risk for stroke. Here is why Hispanic men are at risk for stroke. About half of Hispanic men have a blood pressure greater than or equal to 130/80 mmHg or are taking medicine to lower blood pressure, a major risk factor for stroke. About 1 in 7 Hispanic men have been diagnosed with diabetes, and many more have the disease but do not know it. Diabetes is also more common in people of Mexican and Puerto Rican ancestry than in people of Cuban or Central, South American ancestry. About 1 in 7 Hispanic men smoke. More than 4 in 5 Hispanic men have overweight or obesity. What you can do to prevent stroke. Most strokes can be prevented by keeping medical conditions under control and making healthy lifestyle changes. Number 1. Aspirin. Aspirin may help reduce your risk for stroke by preventing blood clots, but you should check with your doctor before taking aspirin to make sure it is right for you. Number 2. Blood pressure. Control your blood pressure with healthy lifestyle changes. If a blood pressure medicine is prescribed, take it as directed. Number 3. Cholesterol. Manage your blood cholesterol with healthy lifestyle changes. If a cholesterol medicine is prescribed, take it as directed. Number 4. Smoking. Don't start smoking. If you do smoke, learn how to quit. Number 5. Eat healthy. Choose healthy foods, including foods with less salt or sodium to lower your blood pressure, and foods that are rich in fiber and whole grains to manage your cholesterol. Number 6. Get regular physical activity. Regular physical activity helps you reach and maintain a healthy weight and keeps your heart and blood vessels healthier. Adults age 18 and older should get at least 150 minutes, that is, 2 hours and 30 minutes of physical activity each week, and do muscle strengthening activities on 2 or more days each week. Finally, talk to your doctor about your chances of having a stroke, including your age and whether anyone in your family has had a stroke. Thanks for watching, and please subscribe for more.